Thank you, Chet. Saturday marks the one-year anniversary that Montanans have been living with the COVID-19 pandemic within our own state, and it started right here in Gallatin County. In a three-part series, MTN's Cody Boyer sat down with the man who has been at the forefront of the Gallatin County battle against the virus to reflect on what he, as well as all of us, have gone through so far.
It's hard to believe for many of us, and for others, not as much. But this week, we've been living with the pandemic for an entire year. And we've been doing so as well here at the station. A lot of the hallways have been this quiet since the beginning, and that's been that case with businesses across the Gallatin Valley. But for those on the front lines, like the health department, COVID-19 has changed the game entirely.
People are stressed and people are afraid, and they should be stressed and they should be afraid.
This has slowed down many, many businesses.
Basically, every corner of campus has seen some sort of adaptation.
It's a complex and rapidly changing situation.
Yesterday was the real first day that it got hectic.
Hospitals are extremely stressed.
Maybe this is the great reset button so we can just start being nice to each other again.
You know, in New York City, they didn't have enough place to store bodies, and they were piling bodies in refrigerator trucks out on the street.
It's been a long year, one that doesn't seem to get shorter.
That's a game changer in public health. That changes everything.
On the evening of March 13th, 2020, the first COVID-19 case was announced in Montana. Not only the 13th, but Friday the 13th. And it was in Gallatin County. Almost 10 years since Health Officer Matt Kelly started with the Gallatin City County Health Department.
Nobody gets into public health to get rich. Nobody gets into public health to be famous. In fact, it's public health really, you know, when things are going well, we're anonymous.
But COVID-19, the coronavirus, whichever you call it, found a way. And now his is a face that now shows up on TV at least once a week.
I think like everybody, you're not quite sure what to make of that. We've had other viruses that have been significant, but nowhere near what this one became. We've had the MERS virus, the SARS virus.
More than 101,000 cases and waves of restrictions, from the mask mandate in July to enforcing closing times in September, October, November. Before that, I would meet with Kelly to talk about things like pertussis, bed bugs, the flu.
It was way bigger, and there was way more that we didn't have control of. What kind of virus causes you to lose your sense of smell and taste? And that's just weird.
Students stuck overseas, schools first closed, then through computer screens. All the while, public health officials and contact tracers raced against an invisible enemy.
We have been contact tracing for decades in public health, centuries in public health. It goes back, you know, to medieval times. It was massive.
You work for us! It makes me sad. We should be able to listen and talk to one another.
There's no scientific evidence!
Scenes like this ignited across the country. The Gallatin City County Board of Health, a public meeting to start requiring face coverings in the valley, and an auditorium filled with people. To Kelly, it was a morning that caused a shift.
One of the hardest times in a church parking lot, I had somebody screaming in my face that they thought I should burn in hell. And, you know, calling me a fascist communist that should burn in hell. And I'm standing in a church parking lot just coming out of a meeting that had been sort of occupied and disrupted by people who were upset about having to wear face coverings. And that was pretty disturbing.
In Gallatin County since the beginning, Cody Boyer, MTN News.
Well, Cody reports that's just scraping the surface. You can watch part 2 tomorrow morning, exploring more of the hardships and also the positives that people found during this last year.